people think it means closing the disparity between the dominant group, i.e. whites, and everybody else. And while that's a legitimate goal, I want to suggest that really the goal is to set a universal goal and to get every group there.
Equality is about sameness, and it only works if everybody starts out from the same place. Equity is about fairness, access to the same opportunities, and sometimes when we're thinking about equity, we have to shift resources or allocate more resources, and that's what the boxes are showing. Sometimes you have to push a little bit more resources to get everybody to the same level. And really, we cannot enjoy equality unless we have equity.
So our health is created by our living conditions. It's created by the environmental conditions, the built environment, whether or not we're poor, whether or not we're white or a person of color. All of these determinants are the things right now, because of the way our society is structured, make us on a path to health or on a path to illness.
A lot of decisions are based around economic power and voting power. And so you're automatically at a disadvantage when you're in rural, because you don't have that political power through votes, and you don't have the economic power through a lot of businesses that you find in urban areas.
In today's parlance, we don't talk about segregation much anymore, although recently it's gotten some press. We think, why does it matter? Segregation is never just separating people based on race or ethnicity. It's the way we distribute opportunity. So when we talk about a group being segregated, we're talking about a group being segregated from opportunity and for the determinants for a healthy, vibrant life. And most of us, when we pick a neighborhood, we intuitively try to pick a neighborhood that have those things. If we have children, we think about a school system, we think about a grocery store, we think about a park, we think about public transportation. We think about places that are safe. All those things matter. And then we put a price tag on it so that most people can't live there. Crime has a powerful impact on health outcomes. If you're exposed to 4 shocks, 4 traumas, it restructures the brain. Low-income black children, by the time they reach 11, have been exposed to as many as 10. So they're suffering from post-traumatic stress syndrome because of the environment they live in. You go into some inner-city schools, and virtually every kid knows someone who's been shot or beat up. And it's not just affecting the person that's shot, it's affecting the entire community. And so those kids are dealing with stress, and then they go to school with medical needs, and oftentimes they're misdiagnosed. Race in our society and how it operates is independent of SES. It actually is cumulative with it, but it's not the same. And along every indicator, life expectancy, quality of life, we see huge disparities between whites and non-whites. And again, it's not just because of where people live, it's also because of how race operates. You can actually boil all these social determinants down to belonging or being othered, being told that you don't belong, being told that this is not your place.
So working in partnership, it's really, really important to work in partnership. I think especially in rural and frontier areas, one of the assets that we have, I think one of the advantages that we have is we tend to be very collaborative because we're used to having fewer resources oftentimes that is available in urban communities, and so we try and make the best of what we have.
The question of what this work looks like is for a lot of people, a lot of us in our society, we don't know what that work looks like. We might have all kinds of ideas about what it looks like, but I think it looks an awful lot like this. These are people acting and building their capacity to act to change the conditions in which they live so that they themselves can be on a path to health. Voting, canvassing your neighborhood, coming out for a march. Power is the capacity to act. Our theory of change in community organizing is fundamentally grounded in a theory of power.
How do we make sure that everybody belongs? How do we not other people? In your work as health providers, to sort of think about all these things, to think about the networks your communities have, to think about how they're connected, to think about where they live, to think about what we're doing to produce positive and negative health outcomes and positive and negative well-being. And I'll end by saying, Wendell Berry, he says, health is membership. Thank you.